Top medical experts in Houston are starting to warn about the possibility of a fourth COVID-19 wave as our low, stable case and hospitalization rates that we saw throughout the spring are starting to rise, and the Delta variant is becoming more and more prominent here locally.
Fox 26's Maria Salazar live tonight at the Texas Medical Center with more on what leaders there want everyone to know. Maria, she's live at home. Maria.
Hi, Jonathan. That's right. So the Texas Medical Center had a briefing today, and they described how Houston is falling in line with what we're seeing across the country. In fact, just today, the director of the CDC said that the Delta variant went from making up about 50% of the COVID-19 cases on the week of July 3rd to now more than 80%.
It's sad and depressing or frustrating to see what we're doing right now, but we have seen a significant increase in hospitalizations over the last 14 days.
Memorial Hermann reports a 200% increase in COVID-19 hospitalizations as the Delta variant spreads and vaccination rates lag.
Well in excess of 96% of the patients we're admitting to the hospital have never been vaccinated or not fully vaccinated.
Other Houston area hospitals are seeing the same trend.
In Texas Medical Center, our hospitalizations are up 90% over that same period. We are clearly seeing the beginning of the fourth wave.
The focus is on the Delta variant.
It's not only more infectious, it causes more disease and it causes more death.
Dr. Paul Klopman, CEO of Baylor College of Medicine, describes the original COVID-19 virus as having a 0.5% fatality rate, the UK variant as 0.9%, and the Delta variant as 1.1%. He adds it's also impacting treatment.
It is enough different that the monoclonal antibodies, for example, that were effective infusions against early disease before with the UK variant, these are no longer effective against the Delta variant.
The leaders say they do not expect the increase in hospitalizations and deaths to reach the previous levels because many older adults are vaccinated. However, they believe most of them can be prevented if more people get vaccinated.
The virus mutates every time it replicates, and so if you prevent replication of the virus, you prevent the development of mutations.
And they worry about long COVID.
We're seeing up to 26% of young adults get long COVID. We don't have good data yet on the adolescents and little kids.
As for the Lambda variant, a case did show up at Houston Methodist, but it's unclear if it's more infectious.
It's considered right now a variant of interest, not quite a variant of concern.
And now with the Delta variant, it's sparking a lot of talk about a booster, but who could need it and when? I asked the doctors. I'll have what they said on the News Edge Early Edition at 6. Maria Salazar, Fox 26 News.